The community program presented today is the REAP program. The Community Program Proposal REAP is an innovative life skills and nutrition training program for homeless women who are in the process of recovering from substance abuse and addiction. The population for the community program includes homeless women with and without families recovering from alcohol and or drug addiction, residing in temporary transitional housing. The program assists women in the process of recovering from substance abuse and addiction rebuild their lives, maintain their recovery, care for their families, and prepare for transition into healthy, independent, self-sufficient, and secure women to become vital contributing members of the community. The REAP program will attempt to address significant issues that these women and their families face, which include safety, a more permanent home, food security, nutrition, health, and addiction. These issues occur simultaneously and are not mutually exclusive. They consistently engage psychological, social, physical, and biological dimensions of behavior. The importance of nutrition in aiding recovery from addiction has been reviewed and researched. Evidence indicates that subjects with alcohol and drug abuse disorders typically suffer from poor nutritional status and nutrient deficiencies, which in turn may complicate and possibly prevent recovery. Poor nutritional status impacts the physical and psychological health, contributing to anxiety, depression, altered body composition, altered hormone regulation, and other illnesses associated with malnutrition. There are 6 lessons in the program, the nutrition component of the program: nutrition basics, nutrition and recovery, meal planning, eating on a budget, understanding food labels, food safety, mindful eating, how to create healthy habits. The 6 lessons will attempt to provide fundamental knowledge and skills to the participants of the program so they can be confident, successful, and move ahead with their recovery and independently care for their families. The transitional housing is located in the Charlestown Navy Yard in the YMCA. The Navy Yard is a 130-acre rectangular-shaped area closed off by water on one side and a major roadway on the other. Within the area, there are 2 restaurants, a convenience store, and a hotel, but the nearest grocery store is 2 miles away. Within the transitional housing, there are vending machines, food preparation and storage areas, there's a daycare, and public transportation is available. Charlestown is an area community within Boston, and the total population is over 4 million. There are over 265,000 households, 45% are family, and 55% are non-family. Here's some of the population demographics of note here. 17% of the population and 37% of the children live below the federal poverty line. Of married couples, 32% are living in poverty with their families. Of male households with no wife present, it's 3.4% live in poverty. And of female households with no husband present, 64.2% live in poverty. This is the population we will address. The food environment within the neighborhood: there are 3 grocery stores within a 5-mile radius of the transitional housing: Market Basket, Star Market, and Whole Foods. The food analysis indicated that all stores had all of the listed items with the exception of 1 item from Whole Foods, which was Fudgicles. Market Basket prices were 12% lower than Star Market and 18% lower than Whole Foods, but Market Basket was the farthest distance from the transitional housing site. Greater Boston is located in a tract with a poverty rate of about 20% and a family income less than 80% of the median. 1 out of 9 people in Massachusetts are food insecure. 1 in 6 children suffer from food insecurity. 67% of residents that are eligible for assistance but are not participating. 680,000 Mass Health or Medicaid customers qualify, but they're not currently receiving SNAP benefits. And 750,000 residents do not have access to enough food for a healthy diet. Contributing to some of the major health concerns: obesity. There are disparities in obesity rates that exist by race, education, income, gender, and disability status. In Massachusetts, Hispanic and Blacks are more likely to be obese than their white counterparts. Obesity appears to be slightly more prevalent among men than women, but it becomes more apparent when examining racial groups. Asthma is a growing public concern in Boston. Nationally, the prevalence of asthma has been increasing since 1980 across all ages, genders, and racial groups, while in Massachusetts it's one of the highest in the country. About 30% of adults have hypertension in Massachusetts, and it's ranked 38th in the United States. Only 15% of adults in Massachusetts can recognize signs of a heart attack, and only 23 can recognize signs of a stroke. Cancer is the leading cause of death in Massachusetts. For males, it's lung, prostate, colorectal, and pancreatic. For females, it's breast, colorectal, and pancreatic. There were 183,000 new cases diagnosed in the 5-year period. Oral health is the most common chronic disease in children. 37% of children in Massachusetts had dental decay, and the national average is 22%. Poor mental health was associated with increased smoking, obesity, lack of physical exercise, and chronic disease. 22% of high schoolers, 7% of adults, and 16% of middle schoolers reported feeling so sad or hopeless almost every day for 2 weeks. And the health-related quality of life refers to the perceived physical and mental health of a person or group. It can be used to measure the effect of health conditions on diseases and disabilities. Tracking the quality of life can help guide policies and interventions to improve health of different populations. One of the major health concerns particular to our population in the REAP program is addiction. In 2012, there were a significant number of women admitted to substance abuse treatment. 25% of these women had children under 6 years of age. 34% of these admissions reported living with their children. They reported alcohol and heroin most often as the primary drug of choice. And of the number, the National Survey on Drug Use and Health showed that 4.4% of pregnant women aged 15 to 44 used illicit drugs in the past month. There were 540 admissions to substance abuse treatment services in Massachusetts who were pregnant at admission and were adults 18 years of age or older. In 2012, pregnant admissions reported heroin most often as the primary drug for which they were seeking treatment. The components of the program, there's the overall component that has the mission of the program, which is to assist women in the process of recovering from substance abuse and addiction, rebuild their lives, maintain recovery, care for their families, and prepare for a transition into healthy, independent, self-sufficient, and secure women. The nutrition mission is to inspire and educate individuals to become active participants in improving their own as well as their family's nutrition, health, and well-being. The social marketing will address the target audience. They include homeless women and their families recovering from addiction. There are women in the program to whom the social marketing plan will target, but it's important to reach women who are homeless, suffering from substance abuse, and who do not have resources or assistance. The success of the program is going to depend on behavior change. There are numerous behavior changes expected, but for the nutrition component specifically, knowledge of healthy food options, the ability to read nutrition labels, ability to prepare food that is safe, and ability to plan healthy, cost-effective meals within a budget, as well as create an atmosphere of mindful eating. The benefits of behavior change include mothers are able to feed their families, they're better able to use monetary resources, SNAP, WIC, food bank, school meal programs for healthy food options, and able to meet the needs of themselves and their families so they have access to employment, housing, and they remain free from addiction and sober. The key program components based on the logic model that transitional housing will be provided, employment services, job coaching, resume development, clothing, image consulting, internship opportunities, case management, counseling, social services will be offered, legal services, there's child care available, as well as the nutrition program. The goals of the nutrition program include the participants understanding how nutrition impacts recovery, their ability to change behavior and maintain change while developing healthy eating habits. They will be able to create healthy meal plans within a budget that meet the needs of the family, understand the basic concepts and importance of healthy nutrition, and offer a variety of nutritious foods for themselves and their families. The nutrition component will provide observational and interactive opportunities for participants to develop the skills required to perform these behaviors. The program will encourage the participants' belief and confidence in their abilities to successfully accomplish these behaviors, and assuring these participants and providing certainty that the behavior will have the desired effect of consequences. The nutrition component includes providing the classes, magnifying the benefits, offering a comprehensive approach to address food insecurity, and the provision of resources, advocating for this behavior change. The program will have a community garden, will offer meal vouchers, and most importantly, for our purposes, the nutrition education component, which includes a series of 6 interactive learning activities. Social learning theory is the theoretical model that will facilitate behavior change for the participants of the REAP program. This behavioral theory stresses the interactive nature of having the skills required to perform the desired behavior. This model has been effective in people recovering from addiction. This model requires influencers, people or models who can provide examples of positive behaviors. It will require that there are rewards for behavior change and that the outcome is positive, and it will also require participants to be motivated, maintain focus, retain information, and demonstrate behaviors or changes in performance. Social modeling is a strong method of education. If positive consequences from a particular type of behavior are observed, people are more likely to repeat that behavior themselves. And if negative consequences are a result, people are less likely to perform that behavior. Living in group transitional housing with other women who are struggling with the same issues is an optimum situation to implement the principles of social learning theory. Surrounding the group with external influential models who exhibit both positive and negative behaviors, teaching opportunities for these women to imitate or not, living with others who have been successful with life changes provides evidence of success. Of course, there are always strengths, weaknesses, opportunities, and threats to a program. The results and outcomes of the program success will be dependent on funding, commitment by the community, available resources, external factors will affect the results and outcomes, and availability of qualified professionals. Participants, the success will be measured by the participants. They'll have improved access and increased participation in federal and state programs. They'll be food secure. There'll be improved health outcomes of participants and their families, and the participants will maintain a healthy, stable lifestyle with healthy social networks. Collaboration is key with some of these resources. And here are references. That concludes the presentation. Thank you.